Hi everyone, I am Swapnil Banerjee and welcome to the third part of our video series, The Anatomy of Stomach. And here in this part, we are going to talk about the nerve supply of the very important structure in our GI system, that is the stomach. But before we proceed into the main part of our video, I'd like to tell you that I have already made two previous videos of this video series. In the part 1, I have discussed the basic anatomy, histology and stomach bed. And in the part 2, I have discussed the arterial supply, venous drainage and the lymphatic drainage of our structure stomach. So if you haven't watched those videos, I would like to request you that after you complete this video, I shall add the links in the description box. You can go and check out those videos for better understanding. Now, moving with the nerve supply of stomach. Firstly, talking about the sympathetic supply. So it is derived from the T6 to T9 segment of our spinal cord. And that is the reason the stomach pain refers to the epigastric region of our body. The main job of our sympathetic plexus is vasomotor. That means it helps in the constriction of the blood vessels and it also closes the pyloric sphincter, and that's how it helps in the digestion of our food particles. Now talking about the parasympathetic supply, that is derived from the vagus nerve or the 10th cranial nerve. Now remember the embryology of stomach. During the development of stomach, the gut rotates, and that's why the left part of vagus helps in the formation of the anterior trunk and the right part of vagus helps in the formation of the posterior trunk. The anterior trunk supplies the anterior surface of stomach and also gives off a branch nerve of lateral jet. And the posterior trunk supplies the posterior surface of stomach and it also continues as the posterior nerve of lateral jet. Here you have to remember a very important clinical point, that is the criminal nerve of Grassi. Remember the posterior trunk of vagus gives off a branch in fundus, that is the criminal nerve of Grassi, and when we do highly selective vagotomy, sometimes if the surgeon forgets this part, then it will continue the secretion from the fundal part and that may recur the peptic ulcer. Now talking about the function of the parasympathetic plexus, it mainly helps in the secretion of stomach and the motility of stomach. Now, the stomach has its own nervous system, that is the gastric nervous system. And here we have the Auerbach's plexus or the Meissner plexus. Now remember M for Meissner and M for motility. So Meissner plexus helps in the motility of our stomach and it lies between the circular and the longitudinal muscle layer. Now remember there's another second plexus, that is the Meissner's plexus or the submucosal plexus. And remember from the name, it is located in the submucosal layer. And S for submucosa, S for secretion. So remember it helps in the secretion of stomach. Now time to remember some clinical points. Remember in case of peptic ulcers, sometimes the surgeon proceeds with vagotomy. There's two kinds of vagotomy. One is the truncal vagotomy and one is the highly selective vagotomy. In case of truncal vagotomy, we cut down the main vagal trunk and that is related with a number of side effects. Like in case of truncal vagotomy, pyloric sphincter is affected and that's why we have to perform some drainage system like gastrojejunostomy or the pyloroplasty, and that is related with the early emptying of the stomach and that proceeds with the dumping syndrome. And to avoid this kind of side effects, nowadays surgeons prefer the highly selective vagotomy. In case of highly selective vagotomy, we only cut down the branches supplying the acid producing body of stomach, and here we strictly preserve the nerve of lateral jet so that the pyloric function remains intact. And here also remember the posterior trunk that gives rise to the criminal nerve of Grassi. Don't forget to cut down those branches, otherwise the peptic ulcer will recur. So that was the complete nerve supply of stomach. I have tried my very best to keep this video simple and I hope everything is now crystal clear in your mind. If you haven't watched those previous two videos, I shall highly recommend go and check out those videos because you will really understand those topics better with those videos. Thanks for watching. Have a nice day. Stay safe, keep learning, and bye.